And also, happy Mahashivratri. Today is indeed a very good day where we have these two big things happening on the same day. So welcome everyone to the Women's Day special webinar. We'll just start the webinar in 5 minutes. We wait for more people to join. While we are waiting, it'll be nice to know your names in the chat box and which city you belong to. I'm Shweta Mangal. I'm based out of Mumbai. Hi, Sagar. Mumbai. Great. Good to see some men also on Women's Day special. Amisha, welcome to the webinar from Mumbai. I see a lot of people joining in. It's good. I know it's a holiday today. And it's nice to see people who are joining in, which means they are worried about their health or they are concerned about their health. I won't use the word worry. Welcome, Mahesh from Mumbai again. All right, so we have 1 more minute left and then we can start. The time for the starting the webinar is 11. More people, looks like mainly people from Mumbai are joining in. Anyone from Pune? Jaipur? All right. Great. So we have more people joining in now. There's Lubina from Pune. Happy Women's Day. Bhargavi, is it? Bhargavi? Welcome. Dipali from Pune, welcome. Nice to see all of you. Thanks for making the time to join us on this webinar. There's a lot of men also, which is very, very good. Okay, maybe the videos can be off for everyone. Mahesh, maybe you can make the videos off for everyone. A lot of people wishing happy Women's Day. I feel it's every day a Women Day. But yes, today we can be more pampered by our better halves and our family members. Great. So it's 11 o'clock and I like to start the webinar. So thank you everyone for joining for the special webinar to celebrate the International Women's Day. And a big thank you from the team from Zivia IVF and Zenzo, which is the fast, reliable ambulance emergency service. Just before we start the webinar, I'd like to tell you a little bit about both Zenzo and Zivia. Zivia IVF is the fastest fertility chain growing in India. It is the brainchild of Dr. Naina Patel. And currently we operate 2 clinics in Jaipur and 1 in Pune. This year we are coming up with 5 more clinics and we will be starting in Mumbai and Lucknow. Zivia IVF, the name Zivia means Lord of Fertility. And we believe that we are the best center for giving positive results, especially to people who have tried multiple times to start a family and have failed. Dr. Naina Patel needs no introduction, but she has been in the field for over 30 years. She was the first doctor to start surrogacy in India. Not only that, her team, which includes Dr. Sharayu, Dr. Purnima, Dr. Giriraj, Dr. Richa, Dr. Jyotima, have been able to give very good results in both Jaipur and Pune. I had a normal child. However, I've seen my relatives from very close and friends who have struggled. And I have seen how people go to multiple places, they keep spending money and they are misguided. And one thing which you can be sure about Zivia IVF is that we don't cheat people. We are ethical, we are transparent, and we just believe in one thing, which is to give happiness to people. So that is about Zivia IVF. Our today's speaker, Dr. Sharayu, is from Zivia IVF. And thank you, Dr. Sharayu and Zivia team for making this happen. Coming to Zenzo. Zenzo is a very, very unique service. It is a largest network of ambulances across India. Zenzo, the name means Zen, which means peace of mind, and a place where to go to get peace of mind. So Zenzo services are available through mobile phone, through an app, or through WhatsApp or through email. So Zenzo is the largest ambulance network in India. We have over 15,000 ambulances which are validated and verified on our platform. We just not provide ambulances, but also provide other services like train ambulance, air ambulance, pet ambulance. We are also providing, we are soon launching a special vehicle for people who have a problem in mobility, which will be a special van for mobility assist, and many more services. Do check out our website, www.zenzo.in. And both the teams are here today. And we thought that for this special day, which is the Women's Day, why not have a webinar on women's health? And, I myself, I'm a woman and I am not on the right side of 40s. So it's so important for a woman to take care of their health and especially their reproductive health, because I believe a strong woman, a healthy woman can be the backbone for a family. Everybody looks up to the women in the family for their well-being, for their support. And if the woman in the family is struggling with health issues, it can impact not only the family, but also the environment she is living in. And therefore, we believe that the backbone of a strong family is the woman. And with that, I would like to introduce the speaker for the day, which is Dr. Sharayu. Little bit about Dr. Sharayu. She is MBBS, MS, Ops and Gynae, DNM, MRCOG from UK. She's a consultant and IVF specialist at Zivia IVF Pune. She has been a topper throughout academic career and has over 10 plus years of experience in the field of art and in dealing with cases of infertility, PCOS, and endometriosis. She has several achievements to her name. She is the member of prestigious Royal College of Ops and Gynae. She has more than 5 publications in national and international journals. She's received prestigious appreciation award from Dr. Vikhel Patil Foundation, Ahmednagar. And Dr. Sharayu has been with us for the last 18 months, and the results she's been able to give in Pune is amazing. And with that, I hand over to Dr. Sharayu for today's session. I hope you enjoy it, and thank you very much once again for joining us. Over to you, Dr. Sharayu.
Thank you, ma'am. Thank you for that kind introduction. So, without wasting any more time, I would like to start with my webinar. So, hello everyone. Very good morning to all out there. And Zivia team wishes you a very happy Women's Day. So campaign theme for this International Women's Day this year is Inspire Inclusion. So what does that mean? When we inspire others to understand and value women's inclusion, we forge a better world. And when women themselves are inspired to be included, there is sense of belonging, relevance, and empowerment. So with this, I would like to say that we have come a long way, but then there is possibility of further improvement, and for that, woman has to be in the pink of her health. So with this idea in mind, today's webinar is reproductive health in women, understanding and nurturing women's well-being. So what is health? As per WHO, that is World Health Organization, it is not merely the absence of disease or infirmity, but it is the state of complete physical, mental, and social well-being. Coming to reproductive health in women, what we are going to focus at is firstly the gynecological health, where we will be discussing the menstrual disorders, the period-related issues. Then the maternal health, which starts from the pregnancy, continues throughout the delivery process and the lactation. Then there should be measures taken to prevent the STIs, that is sexually transmitted infections. The abortion services should be safe. And of course, some importance on or some emphasis on psychological well-being. Coming to common ailments in Indian females, the first and foremost is anemia, followed by osteoporosis. Then there are sexually transmitted infections. Some cancers are common, like breast, and in typical Indian scenario, the cervical cancer. Then some lifestyle disorders like obesity, which are increasing the incidence of PCOS-like problem. Then infertility is on the rising trend. And some problems like PMS, that is premenstrual symptoms, some postmenopausal disorders, and stress disorders related to this modern lifestyle. We'll cover one by one. So first and foremost commonest disorder is anemia. What are the symptoms? The pallor, the cold, clammy extremities. Also, because it is putting the load on the heart, then one can develop heart disorders in later life. The other thing is osteoporosis, weakened bones, जिसे कि हम हिंदी में बोलेंगे कमजोर हड्डियां. And this happens because of deficiency in calcium and vitamin D. What are the symptoms? Back pain, hunchback, and bones are brittle. That's why they are easily prone to fracture. Coming to cancers, as I told, common cancers are breast cancer and cervical cancer. And when detected early, the complete recovery is possible in such cases. We'll just have a look at the picture of cervical cancer. So what is cervix? It is the neck of the womb, गर्भाशय की ग्रीवा जिसको हम बोलते हैं. So this is the basic structure which prevents the infection from ascending from vagina into the uterus. But when the abnormality of cells are occurring, this is prone to develop into the cancer. And the second common cancer is breast cancer. What are the symptoms? The symptoms mainly can be lump in the breast, but sometimes there can be just change in the color of the skin or nipple, or there can be nipple discharge. What is more important for early detection is self-breast examination, the details of which I'll be telling in a while. The next, as I told you, the lifestyle disorder. This is PCOS, where the period-related issues are there and the ovulation is not happening normally. So previously, this used to be seen in obese females. What would be the symptoms? The menstrual irregularities, that is period-related problems, then acne, hirsutism, that is excessive hair growth, and weight gain. Nowadays, we are seeing this disorder occurring in thin females as well. So lifestyle plays an important role. The sedentary lifestyle promotes this disorder. Other menstrual related disorders being fibroids and endometriosis, where the periods are heavy and painful periods are there. The other severe problem is infertility. As a fertility practitioner, I'm seeing that the incidence of infertility is rising, and almost 1 out of 5 to 6 couple is suffering from this. So what should be our goal? Everybody knows that maintaining optimum health is the basic goal, but knowledge alone is not enough to bring about the healthy behaviors. So how to deal with these health issues? First and foremost is promotion of healthy lifestyle, which we'll be covering in a while. Then regular physical checkup is necessary. Everybody knows that annual checkup with physician is necessary to check the blood pressure, to check the blood sugar levels. But even one annual visit with gynecologist is very necessary, specifically for breast and pelvic examination. Then there are some screening and diagnostic tests like fasting blood sugar, because as we know that now India is becoming capital of diabetes. So this should be done at least on annual basis, or maybe cancers are common in the cervix and the breast, so cervical cytology. So last month was cervical cancer awareness program, where we saw that this is detectable and preventable as well. So for early detection of this cervical cancer, what can be done is cervical cytology. That means cells of the cervix can be checked and precancerous or early cancerous changes can be detected and treated timely. So there are tests for that, where we are taking cells out of the cervix and checking them with the help of pap smear or liquid-based cytology. The HPV test can also be combined with this. There is something called as primary prevention. That means the prevention of the disease before it actually occurs. So there are vaccines where there are three types of vaccines: bivalent, quadrivalent, or nanovalent. And basically the targeted age group is school-going girls, that is from 9 to 15 years of age. And when it is given in this age group, even 2 doses 6 months apart are enough. For older age group, 3 dosages are required. Even if the patient, the female is married and sexually active, it may not be that effective rather than the previous age group, but still it can be considered in those cases. This is about cervical cancer prevention. The next is breast cancer. So even if this is detected in earlier stages, this can be curable. So there are 2 tests which are to be done. One is X-ray guided, that is mammography. The other one is sonography guided, which is called as sonomammography. The screening should start at the age of 40, maybe earlier if you are having any family history of breast cancer in your blood relatives. And as I told you, the self-breast examination plays important roles. So the first examination technique can be learned from your gynecologist, and at least in once in a month, one should try self-breast examination. Coming to healthy lifestyle, we all know that this is the necessity of an hour, but very few follow it, right? So we'll cover one by one. So what are the components of healthy lifestyle? First thing is to eat healthy, have plenty of water, then to exercise regularly, and there should be measures to reduce the stress. Coming to a healthy, nutritious, balanced diet, healthy food can help to reduce the PMS, premenstrual symptoms. It can boost the fertility, make the pregnancy and nursing easier, ease the symptom of menopause, and keep your bones strong. In females specifically, there are some hormonal changes associated with menstruation, childbearing, and menopause, which put them under high risk of anemia, weakened bone, and osteoporosis, which requires higher intake of nutrients such as iron, calcium, vitamin D, folic acid, and other minerals like magnesium. We'll just have a quick look at the food sources which are rich in iron, calcium, and vitamins. So iron content is higher in non-vegetarian foods, but if you are strict vegetarian, then there are some foods which should be focused on to increase the iron content in your diet. So these are green vegetables, the skin or cover of the potato, as well as peanuts. Then there are some raisins and fruits and nuts. And nowadays, some cereals are also fortified with these ions and vitamin D. When it comes to calcium, we all know that dairy products are rich source of calcium, so that should be consumed in proper amount. Coming to folic acid, This is the vitamin which is considered in early pregnancy supplement. So this basically reduces the chances of neurological birth defects if taken before conception. And this is continued till at least 3 months of your pregnancy. It reduces the stress. So we'll see the exact mechanism. So it contributes to good health by lowering the risk of variety of conditions which are influenced by obesity and sedentary lifestyle. It contributes to reduction of stress by increasing the endorphins. Those are happy hormones which will help relieving the stress. And also it helps in maintaining the weight. Now, there are two types of exercises, basically, aerobic exercises and anaerobic exercises. So aerobic exercises are all your cardio exercises like running, walking, even Zumba and other cardio exercises, which will have the involvement of cardiovascular system, that is heart in it. The second type is anaerobic exercise, such as weight training, which improves the individual muscle mass and it reduces the stress on cardiovascular system. How much exercise is needed? Moderate amount of exercise, at least 5 hours per week, is necessary for all the women in the reproductive age group. Coming to yoga and meditation. Yoga increases the flexibility of the body. So it is very important, specifically when it comes to spine disorders. Meditation, yes, we all know that this is necessary for inner peace, for reducing the stress and anxiety, but very few do practice it. Why it is necessary? Because yes, all the answers are not given by Google. So how much time one should meditate? At least 20 minutes per day. But if the person is really too busy, then probably more time should be spent on it. At the last, I would like to comment upon the menstrual hygiene also. So observing personal hygiene is necessary to prevent the reproductive tract infection, the skin irritation, the local itching and bad odor. For a washing of genital area at least twice daily, and of course the technique is from front to back area. One should choose the suitable menstrual product, that is pads, tampons or menstrual cups nowadays, those are available. And one has to look forward to change it frequently. Also, the disposal has to be in a proper way when it comes to non-reusable products. So some environmental friendly products are there available nowadays. First is routine pad, which is washable and reusable, but then washing and drying should be happening properly for this. The other thing is menstrual cup. Now this menstrual cup is made up of silicone or latex-like material, which is user-friendly. It is not I'll say very minimal chance of allergic reactions. And these are reusable. The simple washing with tap water, which is clean enough, is can be used for this. One should look forward for hydration and good nutrition during the period days. So with this, I would like to summarize again. Eat healthy and fresh fruit, because we all know that health is wealth. Say a big no to junk food. Exercise and yoga, I cannot emphasize more on this. The Surya Namaskar is called as Sarvangasana because it is improving the flexibility. Also, it is putting some importance on muscle strengthening. And then regular health checkup has to be done at least yearly once. You should show to your gynecologist. Thank you.